And right across the way from the Community Center building is Dmes, Diversified Medical Equipment and Supplies. In fact, we did a segment with them a while back, and they have a lot of different things to offer over there. And we have Romana Apahedian. Did I pronounce that right? I know you just told me, but
Yes,
is that
you
close
did.
enough? All right. And Dr. Rob Dunsing is here today. And what we're going to talk about is really what's called chronic venous insufficiency,
Correct.
which is your veins,
That's
right?
right. That's
Okay.
exactly right.
All right. So we brought along some support stockings here that we're going to talk about as well, that obviously you folks carry over there.
Yes, we do.
And doctor, what is that basically?
So chronic venous insufficiency is something that affects millions of Americans, and a lot of times they don't even realize they have it. But as human beings, we're standing, so our legs are upright, pretty much the lowest part of our body all day long, and our veins are just basically tubes trying to bring the blood out of the legs back to the lungs and then to the heart. So it's a fight for the blood to get up out of the legs and fight against the pull of gravity. So in all of our veins, we've got little one-way check valves, essentially, intermittently in our legs, and they keep the blood flowing out of the leg and prevent it from flowing down. And it's when those valves weaken, which is a very common thing, it creates a situation where the blood doesn't have a stopgap and it just wants to flood back into the lowest part of your leg, and that creates a lot of problems.
And what is the cause of those weakening? Just age?
Age is a kind of a risk factor that helps contribute to it, but the most important link is a hereditary predisposition.
Oh, really? Okay.
Just the type of collagen and connective tissue that makes up the integrity of those valves, just like a lot of tissue in our body. In some people, just has a mixture which it weakens earlier in life than other people.
And what are some of the signs or symptoms? Is it pain? Is it foot pain or calf pain?
The common thing is that people will say that their legs feel heavy and achy, tired. Sometimes it's almost indescribable, and they don't know why, but their legs are tired. They want to go home and put their feet up on an ottoman or something because they're just tired. And it's not until they ask their doctor about it or come see someone like me until they realize there's actually something they can do about it.
Okay, and I would think that, we all get tired legs, but we usually have a reason for it. We can turn around and go, well, I was working out in the garden for 6 hours today or something. So there's a reason, and after, a day or two, it'll start to go away.
Exactly.
This is something they're going to feel consistently, even if they've had a relatively easy day.
Exactly. It's something that becomes a focus on their day, and they're starting to think about their legs more, like, why is this really bothering me? And they start looking for places to sit down and things like that.
Okay. We're going to talk about these compression stockings in just a moment, but are there other measures that can be taken if it goes further than just something that's a relatively mild?
Yeah. There's the whole what we call conservative treatments, which are things like stockings and leg elevation and things like that. If it goes beyond something that can't be controlled with those measures, there's absolutely things we can do. There's been a lot of significant improvements in venous treatment over the last decade, including treating this problem and these valve issues with lasers. Office-based procedures that we do, taking 20, 30 minutes, sending you on your way, and really most people don't skip a beat with work.
Very good. Let's talk about these stockings here, Ramona, in that obviously they have a positive effect on people who might have mild conditions here, but in general, a lot of sports people wear this, golfers and things like that. Professional golfers will wear something like this every time they're out there for obvious reasons. They're on their feet for, maybe 6-7 hours. But how do these work in compared to, I'm going to buy a good pair of sports socks just somewhere?
Right.
What's the difference?
Well, here what we brought to show today is the Medi brand, and Medi is an excellent manufacturer of compression products. They make products to fit everyone's lifestyle. So what we're showing today is your men's sock. This is a woman's sock.
Okay.
And then we have our active sock here, and the sheer and soft.
Okay.
So Dr. Dunsing, maybe you want to elaborate on
Sure.
how exactly they work and they function.
Right. The way they're knitted, these compression stockings, is so that they create, and this is a crucial component of compression stockings, that they have a zone of compression. So it's more compression down at the foot and ankle.
Oh, okay.
And as it goes up the sock, the compression decreases. And so they usually give a range. A standard one would be
interesting.
15 to 20. And 20 to 30 and 30 to 40, and these are in ranges of pressure called millimeters of mercury, similar to a barometer.
Right.
So the compression typically is like a 20 in a 15 to 20. It's 20 down at the foot, and as it goes up, the zone gradually decreases so that it doesn't become the tightest part at the top of the sock and act like a tourniquet.
Yeah, which would be uncomfortable, especially on a hot day.
and could create a worsening or exacerbation of someone's venous
Interesting.
problem. Yeah.
So is it the way that they're constructed? Are they? I'm looking at least this brand here, and they've got an area for the heel here.
Yeah.
How are these fitted to someone? Is it simply, when you buy standard socks, it always amazes me. Your shoe size is 9 or 10. It's going. This fits from 8 to 13. You're like, well, that's good.
Exactly.
What does that tell me?
Exactly. The way these socks are fitted is we do measure at the ankle and at the calf. And our staff are certified fitters, which means that they are trained by the manufacturers on how to properly fit each person that comes in. So it's really important that the fit is exact, and it's key actually to the product being working for them. Basically.
Do they have to be ordered, or you carry a sufficient supply that?
They're all in stock, so we have them in stock. They can come in and just be measured, and then walk out with the sock, take them home.
Okay. And as far as colors, obviously we see black, and this looks like navy and white here. Do they come in different colors so people can wear them out and they're out and about somewhere matching their outfit or something like that?
They do. So they come in these colors, as you can see, the black, the navy, the white, the tans, the suntans, so different, just variations. So they can actually fit to or be worn with different outfits. Okay,
what about maintaining them? Are they, most standard stocks, and what I mean by that is, after a few washings, the elasticity goes out of them and things like that. What about these?
You want to wash them, you can go ahead and wash them in the wash machine, but do you want to avoid drying them in the dryer? So you don't want to do that. So that elasticity actually can, like you said, be maintained. But you typically want to change them out every 6 months, 2 years. Is that what you would recommend?
Yeah,
or so. So they do, yes, they do last quite a while.
Okay. And I can see here there's a range. Is there a range of different price points, just depending, like the sports sock obviously probably has to be a little more durable than what I would consider these are like everyday or dress socks.
Exactly, and they do range depending on the type of sock. So you have your knee high, you have a thigh high available, and then you have a full hose, so basically like a pantyhose, maternity available. So they do range depending on the style and the length of the sock. Okay, and as you said, they come in all different colors. They do. All the normal different colors that people may want. So very good. So again, DMES is right across the street from us. If you know where not the street, the parking lot. So if you know where we are, if you go out the front doors here, look across, you'll pretty much see them over there. And what are the hours? The hours are Monday through Friday, 10 a.m. to 6 p.m. And then we're open on the weekends every Saturday from 10 to 2. All right, very good. And if you think you have a problem with having constant leg pain and you're just bothered by it, it's something you need to get checked out. And how do they get a hold of you?
Well, they can either contact their primary doctor who can refer them over, or they can call us directly. We're located in an office right next to Saddleback Hospital. Oh, very good. Yeah, we've been there for over 20 years. Okay, so. And you know what? DMES, their number is on the screen. So you know what? You can call them too and just say, Dr. Dunsing, we'd like to arrange a visit with him, and you can connect them up, right? Exactly. All right. We sure will. It's good to have you on, and as I said, they have a full range of medical
equipment and supplies over there. You got the shoes and the lift chairs and the carts and everything else, right?
Yes, we do.
All right, good to have you on. Nice to meet you.
Nice to meet you.
All
Thank
right,
you.
we'll be right back.
Likewise.
Very good.
All right.